Hello and welcome. Let's talk about absorption of drugs. Now, what is absorption of the drug? Passage of a drug from its site of administration into the blood through biological membrane is known as absorption of drugs. Now, the important physiochemical properties of a drug for absorption includes lipid solubility, non-polar and unionized. Now, the number of the molecules crossing the membrane per unit area in unit time is determined by the permeability coefficient and concentration differences across the cell membrane. The permeability coefficients includes partition coefficient, which is solubility, and diffusion coefficient, which is diffusibility. Now, what is partition coefficient? It is a measure of the relative affinity of the drug for the lipid and aqueous phase. The increased lipid or water partition coefficient leads to decreased polarity or ionization of the drug. The reduced lipid or water partition coefficient leads to increased polarity or ionization of drug. So degree of ionization influences lipid solubility, which also influences the ability to diffuse through the cell membrane, which affects absorption, distribution and excretion. The proportion of the total drug concentration that is present in either ionized form or unionized form is dictated by dissociation or ionization constant and local pH where drug is dissolved. Now, ionizable group in a drug molecule which tends to either lose a acidic group or add a basic group. The extent to which a molecule has this tendency to ionize is given by the dissociation or ionization constant, which is usually expressed as pKa, which is the negative logarithm of Ka. pKa of a drug. It is the pH of the environment where the drug is 50% ionized and 50% unionized. The pKa of aspirin is 3.5. Now, most drugs are either weak acid or weak base. Acidic drug. For a weak acidic drug, the charged form can penetrate or absorb through the membrane, but uncharged form cannot. Now, acidic drug in acidic environment and in basic environment. In acidic environment, it already contains many free H+, so drug tends to remain H+ and remain unionized, leading to more absorption. Drug tends to lose H+ and remain ionized, leading to less absorption. Now, basic drugs which are also weak. For a weak basic drug, the uncharged form B penetrates through cell membrane, but BH+ does not. For a basic drug in acidic environment, it already contains many free H+ and tends to retain H+ and remains ionized, which is less absorbed. In basic environment, drugs tend to lose H+ and remain unionized, leading to more absorption. Now, drugs incapable of becoming ionized in environmental pH. Lack of ionizable group, unaffected by environmental pH, lipid soluble, non-polar and diffuses rapidly through the cell membrane. Example includes digoxin and steroid hormone. Drugs that are permanently ionized in environmental pH, which contains group which dissociates strongly and remains ionized in body pH, polar, either negative or positively charged, diffuses very less through the cell membrane. Example includes negatively charged acidic like heparin and positively charged basic like ipratropium. Now, drugs that are variably ionized according to the environmental pH. Example includes electrolytes, water-soluble drugs, and lipid-soluble drugs. In case of the acidic drugs, vitamin C is weak. In case of basic drugs, weak includes diazepam and others. Now, absorption or permeation depends upon the solubility, concentration gradient, available surface area, degree of vascularity, and ionization. The sites of the drug absorption includes GIT, which is the principal site, and others include skin, lungs, blood, and eye. Now, the factors influencing the absorption of the drugs in GIT includes molecular weight and size and formulation factors, disintegration and dissolution time, ionization of the drugs or polarity of the drug, pH of the environment, pKa of the drug, blood flow to the absorption site, and the total surface area available for absorption, presence or absence of the food in the stomach, and rate of the gastric emptying, intestinal motility, contact time at absorption surface, phosphorus metabolism, and efflux transporter, which is a recent concept. Now, skin, surface area, lipid water partition coefficient, thickness, vascularity, strength of the skin, these all factors affect. It includes organic phosphate, parathion, and DDT. Lungs, large surface area of the pulmonary alveolar membrane, limited thickness of the membrane, high blood flow of the alveolar region, and example includes volatile anesthetics and aerosols. Now, mechanisms for delaying absorption includes addition of the second drug like adrenaline for LA, by changing physical properties, by changing routes of administration, esterification of compounds, and subcutaneous implantation of the solid pellets, like in steroids. Now, bioavailability. Bioavailability is defined as the fraction of the unchanged drug reaching the systemic circulation following administration by any route. F is equal to 1 means 100%. F is 100% when administered through IV route, and F may be lesser than 100% when given by another route. Now formula, F is equal to F into 1 minus ER. F is the systemic availability of the drug, F is the extent of the absorption, ER is the extraction ratio. Example, morphine and propranolol 33% and 20% respectively. So both rate of absorption and extent of the absorption can influence both clinical and effectiveness of the duration of the drug. Now area under curve. The graphic area under a plot of the drug concentration in plasma versus time after a single dose of the drug or during a single dose interval. Here is a graph, and here is also another graph. Here is also another graph. You can pause it and study. Now, factors influencing bioavailability. Extent of the absorption determined by AUC and others. Phosphorus metabolism, rate of absorption, routes of administration, drug formulation, biological factors. Now, bioavailability studies are done for comparing different formulations and monitoring progress in the drug therapy and individualization of the doses in case of the drugs. Now, bioequivalence. The equivalence of the blood concentrations of two or more different formulations of the same drug measured over time. Bioequivalence to occur between two different formulations of the same compound. They must have the same bioavailability and same rate of absorption. The preparations are said to be bioequivalent when the plasma concentration versus time plots for the two preparations are nearly superimposable if they are given at the same doses by the same route, and one preparation may be safely substituted for the other. Now this is a graph showing the bioequivalence. This is also another graph showing the bioequivalence. Now this is the graph of drugs ABC for understanding bioequivalence. Drug ABC. Here is the explanation of the previous slide. You can study yourself. This is also further explanation. Now, phosphorus metabolism or pre-systemic elimination. When a drug is given orally and absorbed through gut wall and reaches to the systemic circulation via portal circulation, and that drug can be metabolized, most commonly in the liver, also can be metabolized in the gut wall or even in the portal blood before reaching the system circulation. This is called as phosphorus metabolism or pre-systemic elimination. Metabolized during phosphorus in the liver. Liver can also excrete the drug in the bile, and dose can be increased to increase bioavailability. The effect of the phosphorus metabolism on bioavailability is expressed as the extraction ratio. Extraction ratio is equal to Cl liver by Q. Cl means clearance, Q means hepatic blood flow. Drugs with high pass phosphorus metabolism: propranolol, labetalol, oxypranolol, morphine, pethidine, and glyceryl trinitrate, and others. Now, plasma half-life. It is the time taken by the drug to become half in the plasma from its initial concentration. It depends on the volume of the distribution and clearance. Formula includes 0.693 into volume of distribution by clearance. So why half-life is important, or therapeutic importance of the half-life? It's very useful to know the alteration of the plasma concentration in the response to starting, altering, and stopping drug administration. The construction of the dosing schedule includes calculation of the initial dose and loading dose. Also maintenance dose. To maintain a steady state of the concentration, estimation of the time to eliminate drug, and often used as a general guideline for the duration of the drug action. If the drug concentration is constant, it is known as the steady state concentration. So what is steady state concentration? It is SSC in the plasma is the concentration where the rate of the infusion is equal to the rate of elimination. It depends only on clearance. Now, drugs with long half-life. It includes diazepam, digoxin, digitoxin, and azithromycin. The drugs with intermediate half-life includes atenolol, and with short half-life includes benzapenicillin and dobutamine. The clinical significance of the drug concentration measurement includes very useful in achieving beneficial therapeutic responses, to construct the dosing schedule, to know the idea about maintenance dose, to maintain steady state concentration, to identify the desirable routes of administration, to observe the undesirable side effects, to increase effectiveness of drug, to reduce symptoms of toxicity, to know the disease where plasma proteins are increased and drugs with low therapeutic index can be detected, and detect post-antibiotic effects. End of the topic.